Welcome, everyone. This is the second of two webinars that the Alda Center and the Gold Foundation are producing together. Our first webinar last Wednesday focused on the many identities that we all have within us and how those working in healthcare have all made a powerful choice to take on that identity.
We previously explored the many whos you are and the strength you bring to the care environment as a whole person. In this session, we'll explore ways to meaningfully communicate with your patients as well as your colleagues to connect deeper with all of them. By tapping into the many whos you are to others, you can influence a positive culture throughout the continuum of healthcare.
This webinar, like the first, is part discussion and part experience, so please grab a pen and paper so you can write things down. We'll also be inviting you to share some thoughts in the chat. The prepared content should take us about 20 minutes, and my colleagues and I will stick around for 10 minutes or so after the presentation to answer any questions.
Collaboration between our two organizations, the Alda Center and Gold Foundation, to create the webinar is captured in this poem that you see here. And we invite you to view it further, including hearing it read by the author, Frankie Aberland, of the Good Listening Project, and also explore the resources on our two websites.
Great. In the first webinar, we introduced ourselves, and we thought we'd mix it up a little bit for this one, and we'll introduce each other this time. So it gives me great pleasure to introduce Elizabeth, the Chief Operating Officer at the Gold Foundation, and Pia, the Senior Director for Strategy and Business Development from the Gold Foundation. We're really grateful to have you as collaborators. It's been so much fun putting these webinars together and continuing to talk about the way that our missions align and all the resonance there. The Gold Foundation's mission is that healthcare will be dramatically improved by putting human interests, values, and dignity at the core of teaching and practice.
And we're so grateful that the Gold Foundation folks came out to Stony Brook a while ago now to experience our in-person training for healthcare teams. And then after that hour and a half, we had a nice Thai lunch together.
We did. And the Alda Center, actually, your team joined us at the Gold Humanism Summit in Orlando in Florida in 2019. And we were so appreciative that you brought your knowledge and insights to bear there. And we are truly thrilled to be working collaboratively with this team from the Alda Center. So this team is Elizabeth Boisha, also known as eBeth, an assistant professor of practice at the Alan Alda Center for Communicating Science, and the improv specialist of the curriculum design team for Alda Medical, as well as Dr. Sushmita Poti, Chief Medical Program Advisor for the Alda Center, as well as a practicing pediatrician. And we are thrilled to have you with us today.
Yeah, thanks, Elizabeth. The Alda Center's mission is to empower scientists and health professionals to communicate complex topics in clear, vivid, and engaging ways. Similar to the road trips the Gold team took to Long Island and the Alda folks took to Orlando, Gold was able to virtually go the distance and approximate being proximate through Zoom, even before this current situation. We walked the Alda folks through one of our signature programs, Tell Me More, a communication tool which has clear alignment with the Alda method.
And we'll talk a little bit more about that as this brief webinar continues. So we'll call back to last week. Some of you participating today, were you with us last week? Maybe we could have you could raise your hands or give us a little shout out in the chat. I'm going to share a collectively created word cloud, and this was the result of those identities that were shared from participants welcome back. I see a few people raising their hands. So maybe you see yourself in this word cloud in some way. These were facets that were chosen, like that identity to work in healthcare, and some that were not. And I think I had mentioned last week when we did this first round that you can do this exercise time and time again, and it'll change depending on what's going on. Different things will bubble up in the surface, to the surface in that minute of reflection. And we wanted to make sure that we acknowledged, given the present moment and the heightened national focus on systemic racism, particularly the unjust experiences of those who have Black identity, this word cloud would probably be quite different should we repeat this first part of the exercise today. We're going to move on and do a second part of this exercise together today. And that's, so rather than think about yourself and how you define yourself, identities that you might elect, I'd like you to think about the people you work with, the people around you. The Alda Center's training, we focus on team training first and foremost. And so the prompt for this minute of reflection, and this is why Elizabeth had you get that pencil and paper, is to just for a minute, without censoring or worrying about whether or not that's the right thing, just go ahead and write down as many facets as you can that answer this prompt. Your colleagues or coworkers think that I am, right? So it's that I am, that I am, that I am for 1 minute. And I will set my timer and we'll have a minute of quiet while you work on this. I'll give you a 15-second warning. See how much you can write down. All right, your minute starts now. Fifteen seconds left. Thank you. There is a minute.
Thanks, Beth. That was fun. And I'm wondering, you know, as you wrote these things down, you might have thought of some people that you have positive relationships with at work, and maybe some people whom you have negative relationships with at work, maybe neutral.
That
And
designation, it's complicated, right?
yeah, exactly.
Sure.
Exactly. It's complicated. And maybe there's some alignment with a quality that's perceived by some people positively, others negatively. So what seems organized to one person seems inflexible to someone else, courageous versus rash. And what is it in the other person? What's their humanity? What perspective are they coming from that's aligning with the way they view you? So I want to invite everyone, if you're comfortable, to come into the chat and share some of the things you might have written down, maybe some things that you're proud of. We'd welcome whatever you're comfortable sharing. And please set it to all attendees as you're chatting in, so whatever you're comfortable sharing. And what are the kinds of things that you wrote down? Look at your list. What would your friends agree with? Who are you in that personal and professional context? So we have some things coming through here in the chat. Reliable, supportive, engaging, organized, strong, spontaneous. That's great. Ready to jump in and help. Tech savvy. Love that. empathetic, supportive. And I wonder, you know, as you're writing these things down, so what's sort of the things that maybe you're not proud of? Or when you get stressed, do those things get overdone? So does empathetic potentially become ruinously empathetic? Does organized become inflexible? Stickler for detail, soft, too detail-oriented at times. I love it. Thank you so much to everyone for sharing. You know, we really are all whole people, multifaceted. And what do we bring into the patient care experience here? This is great. Thank you so much. Dedicate, but can be bossy and controlling, juggling a lot, too decisive, quick to act, never finishing things, but I'm a very good starter. Love it, love it. Thank you, everyone, so much for all of that. Pia, how does this connect to what Gold's working on?
Absolutely. So thanks, Susmita. That was a great exercise, and thank you all for all the wonderful responses. Understanding your identity and it in context with the relationships you have with the person who's in front of you, as the Alda method enables you to do, it truly is a perfect complement to Tell Me More, which enhances your ability to quickly connect in a meaningful way. To support you during the COVID-19 pandemic, we have created a Tell Me More for COVID-19 Care Toolkit, and it's freely available on our website.
So the Gold Foundation emphasizes the human connection in healthcare. We talked about that at the beginning. So we believe that healthcare must be delivered in a way that is compassionate and collaborative, in addition to scientifically excellent. And to facilitate building that human connection, Gold Humanism Honor Society students at the Icahn School of Medicine in 2014 thought about ways to better get to know who their patients were beyond the diagnoses that they were being treated for. And that was really the birth of Tell Me More. It's a program of the Gold Foundation which has been designed to quickly and easily draw out personal interests and build connections.
Yeah, one of the things that, just to call back to, hey, there's this resonance going on here, is if you notice from this example, we did a round of I am for the first webinar, and that corresponds to that first box in the one with 4 fill-in areas, or 3 fill-in areas rather, the one that's a quadrants. What are your strengths, right? That's a self-identification. And then we just went through a minute of that I am, and that corresponds to how your friends might describe you. So thinking about the personal, and then also how you're perceived by others and by friends. And we had previously done a lot of exercises with many facets, and so when we saw these things going together, we thought, well, we really have something here, right?
Yeah.
Yeah, Pia?
Yeah, it really does. It really does connect together. And if you all would take a look at this slide and imagine that you're wearing a badge with something about yourself that you are sharing with the rest of the care team and with patients. It can be that right now you miss being able to see your patients smile. Or if you are a patient in a hospital bed, or for that matter, you are a family member sharing on behalf of a loved one because they're not able to right now, or they're intubated, so that the care team will know more and can connect with how that person has adopted a new puppy, really likes purple flowers, or roots for a favorite team. Others gain more insight about the patient, the person, outside of their reason for being there. It may even inform their care.
Absolutely. And so we really wanted to give folks on the webinar an opportunity to share something in the chat that you might share with your colleagues and patients that would help you engage. I always say it can be as vanilla as I love ice cream to something that's a little more meaningful.
Yeah, we are obviously in very unprecedented, challenging times in both our country and our world right now. And it might be closer to, I love baseball, but I can't even imagine a season taking place between the pandemic and social unrest everywhere. As you can see, it does not need to be something deeply intimate, but it should matter to you. Share only what is comfortable and appropriate for you and your setting. What different aspects of yourself would you choose to bring forward to share more about yourself? Please use the write-in tool, share with us, engage with us on how you currently might be using Tell Me More or how you might use it in the future.
Yeah, absolutely. And I've already seen some starting to come through.
Yeah.
Being outside, kayaking off the coast of Maine, body surfing. Nice.
Wonderful.
Yeah, body surfing. Wow. You know, that's something I think the teenagers love, don't they? And I was just thinking about last week, I saw a patient in my office, a 17-year-old whose mother brought him in for a regular checkup. And she was so proud because he's going to be going to college this fall. And we were looking at the growth chart, and his body mass index and his weight had sort of gone up. Not a ton, but enough that it was not in the healthy range. And so when we started to talk about it, he said, well, you know, I used to row crew. And obviously, you know, during the pandemic, he couldn't do that. And I said, hey, you know what? I get it. I used to row crew too. So I know how intense that is. I know how much muscle, you know, you have and how much burning of calories you do when you're doing that. And I know you can't do that right now, but let's think about together, how can you get to a place that's gonna help you maintain that healthy weight and keep up the exercise.
Yeah, I love that story. You know, the point of the tool is to think about ways that we can connect more deeply with those around us, right? Be it patient or colleague. And that you are open to hearing about the why behind your patient's experience, and seeing in it a commonality that you could relate to and connect with him on. It gave you that opportunity to really engage more deeply, and that's beautiful.
Yeah, you really might see how this approach can open opportunities for conversations that are important to the patient and their family. It helps to transcend the traditional conversations and capture both the patient and the practitioner as human beings, facilitating a culture of compassion and communication.
Yeah. Thank you all for sharing these wonderful, you know, what you might share to show your, you know, a little bit more of your full self as you come in. If you're in healthcare, you know, nowadays, depending on the setting, you may be wearing a lot of things on top of, you know, maybe a badge you wouldn't necessarily be visible, but you still have that within you. You have that identity, and I think the same thing goes for, you know, the use of these wall stickers for patients. And maybe a caregiver is able to give that information, but maybe because of circumstantially that thing does not end up being filled out, it doesn't mean that the patient doesn't have all of those things within themselves. You know, it's just the tool is really a wonderful touchstone to bring all of those things up to the surface, but they're still underneath there, even if we don't have direct access to it.
Yeah.
Absolutely. So if we could pull up the takeaway slide, I think we're at 1 minute left, believe it or not. And so really, as we've talked about in the first webinar, thank you for that, Ebeth. As we talked about in the first webinar, we are all being challenged to connect in new ways, and remembering those strengths that we have within ourselves, the capacity that we have to be able to do that, and some of the tools that we talked about today and the exercise that we engaged in on both webinars, finding ways to connect and engage with one another in new ways. You may not be able to use your full facial expressions, which are behind the mask, but we still have shared experiences, shared understanding, and ways to engage.
Yes. So Thanks, Elizabeth. If you have any questions, if we could move to the next slide. If you have any questions after this webinar or are interested in finding out more, including how these strategies have been implemented and how they can be brought to your organization, please connect with us. We also would love for you to help us out, if you can, with feedback on the webinars by taking this quick follow-up survey that just popped up and a very brief emailed one later as well. On behalf of all of us at Alda and Gold, we are truly in this together, and the human connection matters now more than ever. We'll get through this together. Thank you for everything you do. We invite you to please feel free to stay on and join us by asking us all of your questions. Who has the first one?
I actually would say that there have been some chats into the write-in as we've been talking, and just where one person wrote in that it felt like coworkers, there was a time when it felt like coworkers only shared about our commutes, and now being remote has really changed that, and so that's a way that people are connecting more now. And
Absolutely.
Someone else noted that just as Ebeth was saying earlier about the I am, I could wear a new badge every week, and so could the students. So I love that as well.
Love it.
Yeah.
Yeah, so the first webinar, if anybody missed it, is available to view. And I did get one question during this webinar. We will do the same thing for this one. We'll do a little post-production and put it up on our websites as soon as we can. Any questions? All right. Any last words from any of us?
Well, thank you all for all that you're doing. Really, we know how hard it is. Thank you for joining us during this really stressful time. And we hope that you all are able to find that humanity with each other, with your patients, with your colleagues. So we have, I think another question, right, from Melanie, whether this could be a model to help dialogue that's so needed to hear the pain and hurt we're feeling individually and reclaim our shared humanity. And that is right on point. Exactly what we're offering here is really kind of a taste, a little bit of how that might work. And if you're interested, Melanie, in learning more about our approaches, feel free to contact us.
Great, thank you for that feedback. If you get the emailed survey, if you want a longer one, let us know.
Yeah, we do not have any plans at the moment for these joint webinars. These are going to be archived. That was one of the questions that I see here. And we are hoping that you will all reach out to us if you're interested in learning more, please.
Yeah, please reach out to both of our organizations. We'd love to talk with you more and see what your needs might be and how we might be able to help.
All right, thanks everyone. I think we'll officially end the webinar. So I'm going to close that polling. If you haven't done that yet, make sure you do that on your way out of the Zoom room, as we say. Take care.
Take care, everyone.
Bye.
Bye.